Hello everyone, welcome to my another video. Today we discuss about special MCQ for upcoming NORCET 2023. This is part 5. For more important MCQ on nursing subjects, make sure you subscribe to this channel. Question number 41. A nurse is teaching a parenting class. What should the nurse suggest about managing the behavior of a young school-age children? Option A. Avoid answering questions. B. Give the child a list of expectations. C. Be consistent about established rules. D. Allow the child to plan the day's activities. Right answer is option C. Be consistent about established rules. Because of a short attention span and distractibility, consistent limit setting is essential toward providing an environment that promotes concentration, prevents confusion, and minimizes conflicts. Questions should be answered, but the answers should not be judgmental. And a list of expectations may be overwhelming at this age. Parents need to assist children with routine tasks. Children this age may not be concerned with time frames. Next question. Which nurse collaborates directly with the client to establish and implement a basic plan of care after admission? Option A. Primary nurse. B. Nurse clinician. C. Nurse coordinator. D. Clinical nurse specialist. Right answer is option A. Primary nurse. The primary nurse provides or oversees all aspects of care, including assessment, implementation, and evaluation of that care. Next question. A client reports severe pain 2 days after surgery. Which initial action should the nurse take after assessing the characteristic of the pain? Option A. Encourage rest. B. Obtain the vital signs. C. Administration of an analgesic. D. Document the client's pain response. Right answer is option B. Obtain the vital signs. Immediately before administration of an analgesic, an assessment of vital signs is necessary to determine whether any contraindications to the medication exist. For example, hypotension, respiratory rate less than or is equal to 12 beats per minute. Next question. A nurse in the surgical intensive care unit is caring for a client with a large surgical incision. What medication does the nurse anticipate will be prescribed for this client? Option A. Vitamin A or Equazole A. B. Cyanocobalamin or Cobex. C. Phytonadione or Mephiton. D. Ascorbic acid or Ascorbicap. Right answer is option D. Ascorbic acid or Ascorbicap. Vitamin C plays a major role in wound healing. It is necessary for the maintenance and formation of collagen, the major protein of most connective tissues. Vitamin A is important for the wound healing process. However, vitamin C is the priority because it cements the ground substance of supportive tissue. Cyanocobalamin is a vitamin B12. It is needed for red blood cell synthesis and a healthy nervous system. Phytonadione is vitamin K, which plays a major role in blood coagulation. Next question. A nurse is preparing to change a client's dressing. What is the reason for using surgical asepsis during this procedure? Option A. Keeps the area free of microorganisms. B. Confines microorganisms to the surgical site. C. Protects self from microorganisms in the wound. D. Reduces the risk for growing opportunistic microorganisms. Right answer is option A. Keeps the area free of microorganisms. Surgical asepsis means that practices are employed to keep a defined site or objects free of all microorganisms. Next question. What are the desired outcomes that the nurse expects when administering a non-steroidal anti-inflammatory drug? Option A. Diuresis. B. Pain relief. C. Bronchodilation. D. Anticoagulation. Right answer is option B. Pain relief. Prostaglandins accumulate at the site of an injury, causing pain. Non-steroidal anti-inflammatory drug, that is NSAIDs, inhibit COX-1 and COX-2, which inhibit the production of prostaglandins, thereby contributing to analgesia. Next question. A nurse is caring for a client with diarrhea. Which clinical indicator will decrease? Option A. Pulse rate. B. Skin elasticity. C. Specific gravity. D. Body temperature. Right answer is option B. Skin elasticity. Skin elasticity will decrease because of a decrease in interstitial fluid. The pulse rate will increase to oxygenate the body's cells. Specific gravity will increase because of the greater concentration of waste particles in the decreased amount of urine. The temperature is also increased, not decreased. Next question. In what position should the nurse place a client recovering from general anesthesia? Option A. Supine. B. Side lying. C. High Fowler. D. Trendelenburg. Right answer is option B. Side lying. Turning the client to the side promotes drainage of secretions and prevents aspiration, especially when the gag reflex is not intact. This position also brings the tongue forward, preventing it from occluding the airway when it is in the relaxed state. The risk for aspiration is increased when supine position is given. High Fowler's position may cause the neck to flex in a client who is not alert, interfering with respirations. Trendelenburg position is not used for post-operative client because it interferes with breathing. Next question. What is the priority nursing intervention for a client during the immediate post-operative period? Option A. Monitoring vital signs. B. Observing for hemorrhage. C. Maintaining a patent airway. D. Recording the intake and output. Right answer is maintaining a patent airway. Maintenance of a patent airway is always the priority because airway obstruction impedes breathing and may result in death. Other options are important post-operative care. However, a patent airway is the most priority. Next question. What component of hand washing is the most important for removing microorganisms? Option A, soap. B, time. C, water. D, friction. Right answer is option D, friction. Friction is necessary for the removal of microorganisms. Although soap reduces surface tension, which helps remove debris, without friction it has minimal value. Although the length of time the hands are washed is important, without friction it has also minimal value. Water flushes some microorganisms from the skin. Without friction it has also minimal value. So this is the today's video. Thank you so much for watching my video.